Hi there, it's On from Living with Parky. Welcome. This is an update on the Neurosurgeon, which was one of sort of the final steps, I suppose, in preparing for deep brain stimulation. And I apologise for the delay in getting this to you, but there's been a few things that have gotten in the way, namely life, COVID, finishing work, making plans. And doing a kitchen update because that's what you do just before you go and have surgery. Anyway, so I had a meeting with the neurosurgeon, and I suppose the focus was really about the neurosurgeon wanting to ensure I understood the process, the risks, what the device was like, and so on. So he basically talked through the process of the surgery. So what it means for me is that they'll have two basically insertion points in the head where they'll put a probe down on each sort of side, and there'll be like a little lump there, but given I've got quite a lot of fine hair, that will be fine. And those sort of probes go down and then they're connected to a wire which I think sort of comes down the side and then comes down in under your skin, down through your neck, and then it comes down to a device which controls it, a bit like a pacemaker. And from what I understand, it's probably about the size of my pillbox. And then that will sit in under the skin. And I've seen it on someone before, which was actually good to see it because it's actually quite prominent. And so I was glad to be aware of that because I think I would have gotten a bit of a shock otherwise. So anyway, so that sits there. And with the surgeon and neurologist that I'm going through, I'll be asleep for the whole time. Process will probably take 3 odd hours, and they use, which I think is probably quite common, an MRI scans, which I've already had, but then they pair that with a brain CT scan, which is, live, if you like, and then they map them together. He did warn me that they lighten the anaesthetic so that they can check impulses. And he said, so just to be aware that you might actually be able to hear voices at some point and not to worry that it wasn't coming out of anaesthetic. I wasn't going to feel pain, but they just lighten it so that they can actually get the adjustments right. Quite an important part of it too was really going through the risks and the risk of failure as well as stroke, death, bleeding on the brain and so on. So and also being a woman, he warned me that the unit might take a little bit of time, if you like, to sort of form the scar tissue, particularly given it's near the breast, and it may actually sort of move around a little bit, which is also good to know. But basically, there's about 1% chance of bleeding on the brain, and a 1 in 200 chance of serious stroke, which is incredibly low, and for which I am eternally grateful, but it's still there, so you just still need to be aware of that. I think they spoke about that 1 in 3 may actually need some support in terms of adjusting the DBS to manage the impact on mood, and I'm talking about things like anxiety and depression. So I haven't had any issues with anxiety and depression, but it's actually good to know that they're attuned to that because that's not the case for everybody. And, I think in the past there has been some risk of suicide, so they've actually gotten onto that really well. He actually also told me that about 1 in 250 can lose insight, and I was like a bit puzzled about what that meant, and he explained it as, I think they had a patient who actually got their gear off and was wandering around the hospital ward, which wouldn't be a very good look given I work in sexual assault as a counsellor. So it's good to know they're onto that one. But anyway, look, to be honest, you have to determine your own level of risk. They've lost one patient either in surgery or as a result of surgery, and that was in about 400. So a 1 in 400 chance. So that is something we have to come to terms with. And for me, it was an acceptable level of risk because I can't keep going the way I'm going, to be honest. So we all have to make that decision, and I made that decision with my partner. Probably more of a chance is really needing adjustment. And he talked about sort of 1 in 30 to 40 might need adjustment of the actual, the electrodes and so on. So, and that can be done. And he was saying that they don't like they can actually adjust when they're in surgery, but they don't like to do it too much because that actually increases the chance of bleeding in the brain. So, to be honest, I was really impressed with all of this, the way they've gone about it. Probably the biggest thing I don't know is the sort of state that I'll be in when I come out of surgery. And, I think there's a lot of individual factors that play into that. The surgeon felt quite confident that I wouldn't be too bad, but I don't know what that means. Like, bad compared to what? So I'm really not sure how confused I'll be. The reality is it's brain surgery, and we know that there's going to be inflammation in the brain. I may come up with a couple of black eyes as well. So I've warned my children about that, and that sort of thing. So, but, as far as it goes, I am looking forward to it. And it was great to finally have that conversation. So anyway, I hope that's helpful for you in terms of understanding what it's like going through that last step with the neurosurgeon. Cheers.